Hello everyone, welcome to my channel. This is a small video of an ERCP procedure that was done for a 25-year-old female who had complaints of abdominal pain and jaundice. She was found to have distal CBD calculi on CT scan. We routinely do ERCP in supine position with patient under sedation. After reaching the duodenum and identifying the papilla, the scope is brought into a short loop position. This is done so that we have the papilla at 12 o'clock of the screen. A guide wire that is preloaded onto a papillotome is then used for CBD cannulation. Here you can see that the papillotome is hooked into the papillary opening and the guide wire is passed into the CBD. Cannulation of CBD is confirmed on fluoroscopy. Here on the fluoroscopy image, you can see that we have achieved CBD cannulation. Also, you can see some amount of bile coming out of the papillary opening, which also confirms the cannulation of CBD. After cannulation, a small amount of contrast material is injected into the papillotome. On the C-arm image of a cholangiogram, you can see that the CBD is dilated uniformly and there is a distal filling defect with smooth distal tapering. After a cholangiogram is taken and presence of CBD stone is confirmed, a papillotomy is done to make the papillary opening wide enough to aid in extraction of the stone. After papillotomy, a stone extraction balloon is passed over the guide wire. It is inflated deep within the CBD and is then brought out. Along with it, the stone, sludge and debris is all extracted out of the CBD into the duodenum. Here you can see that a fairly large stone, which was seen on the cholangiogram, is brought out. Multiple trawls are taken with the stone extraction balloon to achieve complete clearance of the CBD. A fully inflated balloon is brought out of the papillary opening without much resistance, which shows that the papillotomy which was done was quite adequate. Finally, to confirm that the CBD clearance is achieved, we do an occlusion cholangiogram. Here the occlusion cholangiogram shows that the CBD is cleared completely. Post that, a 7 French Teflon stent is passed over the guide wire across the papillary opening into the CBD. Stenting the patient after stone extraction is our routine practice. The patient is then observed for a couple of days, and if the patient does not develop post-ERCP complications like pancreatitis, the patient is subjected to cholecystectomy. Stent removal is done 4 to 6 weeks after cholecystectomy. Thank you for watching this video. Please leave your comments in the comment section if any.